This is Plant-Based Briefing. Learn how to live without arthritis and joint pain, Part 2 by Alan Goldhamer at nutritionstudies.org. I'm Marian Erickson. This is the curated content plant-based podcast where I narrate articles relating to plant-based and vegan living with permission in about 10 minutes or less every weekday. And today's article was longer, so it's a two-parter. I read part 1 yesterday, so go back and listen to that first and then jump in here for the second half. And now let's get to today's plant-based briefing. Learn how to live without arthritis and joint pain, Part 2 by Alan Goldhamer at nutritionstudies.org. Dietary factors. People in other cultures work just as hard as Americans do, and a certain percentage of those populations probably have genetic predispositions similar to those of Americans. But people in those cultures do not always develop arthritis at the same rate as in the United States. Why? It appears that diet could be a major factor. The incidence of arthritis is lower and the ability to manage it is higher in places where people consume smaller quantities of animal fat and animal protein than we do in the U.S. For instance, vegetarian and vegan diets have been shown to decrease arthritis pain and inflammation. Even the more moderate Mediterranean diet, characterized by lower consumption of animal products, is associated with a lower risk of rheumatoid arthritis. At the True North Health Center, we see many people experience a decrease in their osteoarthritis after changing their diets. In particular, the two biggest dietary culprits seem to be animal fat and animal protein. The dietary changes do not reverse joint deformities, but the pain diminishes because the improved diet helps reduce the inflammation in the joints. Eating animal products. Any foreign substance that enters the body and triggers an immune response is called an antigen. Our immune system manufactures antibodies to respond to these invading substances, and thus antibody-antigen complexes are formed. The invaders can be viruses, bacteria, or even food proteins. These antibodies fight antigens by attaching to them and clumping them together to form complexes. Many antibodies and antigens clump together. These complexes are usually eliminated from the body by the immune system, but for some people this does not happen. Instead, the complexes become lodged in various tissues around the body where they cause inflammation. When these complexes lodge in the joints, you get pain, swelling, and redness. Diet can play an additional role if a person's intestines allow large food proteins to enter the body. When we eat, our digestive system breaks the food down into smaller and smaller particles. In most people, the particles must be very, very small, down to their basic components, before they can get from the digestive tract into the rest of the body where they're put to use. But in some people, proteins get through at an earlier stage when they are quite large and complex. This is known as intestinal permeability, or more colloquially, leaky gut. When these larger proteins get into the body, they are perceived as antigens. The body starts attacking them and trying to eliminate them. Eating a high-protein diet, especially one containing animal products, may make people who have a genetic tendency to allow larger particles into their bodies more susceptible to arthritis. A study published in The Lancet supports the contention that diet plays a role in controlling numerous arthritis symptoms linked here. Compared to a control group, individuals randomized to fast before transitioning to vegan and vegetarian diets for a year showed significant improvement in several measures, including pain score, duration of morning stiffness, health assessment questionnaire, and strength. Fasting and recovery. People can have very different reactions to various antigens. Dairy products, eggs, beef, wheat, and corn are the most common culprits, but there are many others, some of which are quite obscure. If a person suffering from rheumatoid arthritis wants to identify their food sensitivities, the best method is to undertake a period of fasting, ingesting only pure water, followed by a period of rotational feeding. Many arthritis patients have fasted at the True North Health Center. During the fasting period, it is common for joint pain and swelling to totally disappear. This pain-free period provides welcome relief, but proper refeeding after the fast is crucial. In fact, there's no point in undertaking a fast if your intention is to revert to your previous way of eating, because this behavior is part of the problem, and possibly the major part. Life after the fasting. During the refeeding period, we can find out which foods are contributing to the joint pain. We introduce various foods slowly, one at a time, starting with those that are least likely to cause problems. Ideally, every patient would adopt the dietary lifestyle we recommend at the center, a plant-based diet of fresh fruits, vegetables, various nuts, grains, and legumes. This diet is low in fat and protein, high in fiber, and contains no animal products. But some people's systems are intolerant to even some of these plant-based foods. Arthritis patients need to learn the types and amounts of foods they can eat without inducing symptoms. Some people find that they cannot tolerate very much fruit. Others find that they can tolerate some vegetables but not others. Simply eliminating the worst offenders, meat, dairy products, eggs, and wheat, may not adequately relieve the pain in a particular individual. Refeeding is a learning process. Each person is different and must learn how to eat and modify their lifestyle in other ways to remain free from arthritis pain. As a result of their new awareness, many people come to consider their arthritis a kind of blessing because any recurrence of their arthritic pain reminds them of their need to adhere closely to a health-promoting lifestyle. Experience of success. At the True North Health Center, we have found that the most effective approach to arthritis involves an appropriate period of supervised fasting, followed by a health-promoting diet, moderate exercise, adequate rest and sleep, good body mechanics and posture, and, when appropriate, chiropractic manipulation and physical therapy. Arthritis is something our patients are learning to live without. You just listened to Learn How to Live Without Arthritis and Joint Pain, Part 2 by Alan Goldhamer at nutritionstudies.org. And I'm your host, Marian Erickson. I've done a number of other episodes about fasting, about arthritis, and you may be familiar with the True North Health Center if you've watched some of the documentaries. In particular, I think it's What the Health that goes into one of the great success stories at True North Health Center. And Chef AJ always talks about what a great place it is as well. So check out that documentary, What the Health, and for those related episodes, wherever you listen, use the search field or go to plantbasedbriefing.com episodes and use the search field there. Type in fasting, type in arthritis, and those will come up. So please share this episode with anyone who might benefit, and thanks for listening.